Hey folks, my name's Todd Mansfield and I'm here from Byron Herbalist, and today we're going to be talking about inflammatory bowel disease, some natural treatment approaches and some root causes, some theories on inflammatory bowel disease, the root cause drivers that I don't often hear talked about. First off, inflammatory bowel disease is generally made up of either Crohn's disease or ulcerative colitis. There's also a few other varieties, but those two make up the bulk of inflammatory bowel disease patients. And the symptoms include abdominal pain, mucus and blood in the stool, that's a really big one, and also multiple bowel movements a day, and malnutrition, caused by those multiple bowel movements a day. Oftentimes, when people present in the clinic, they know they have inflammatory bowel disease because the symptoms are so severe. They've been to their doctor and they've got a diagnosis and they're looking for alternative treatment options. The first question is, are you in an active form of inflammatory bowel disease? Because IBD patients, they oscillate between flares of IBD and all the symptoms that we mentioned, and then remission, where they won't be experiencing many symptoms, and then something will trigger them and they'll go back into a flare. And so first off, we need to know if you are in an active form of inflammatory bowel disease, and if you are, the number one priority, the only priority, is bringing you into remission. And so two really potent anti-inflammatory herbal medicines that have good clinical evidence and good research supporting their use are turmeric and also boswellia. If we aren't quite getting the success that we are hoping for with those two herbs, then a third herb, wormwood, also has some research supporting its use, and we can bring that out to really help bring the patient into remission. Once we have you in remission, the next step that we need to determine is what is driving that inflammatory response. So looking at the literature, we can see genetics and we can also see environmental triggers. It's very much recognized as an autoimmune disease. But for me, my bias is the microbiome. So I would like to look at the microbiota of inflammatory bowel disease patients. And oftentimes, when we use these, more functional stool tests, looking at the complete bacterial makeup of the large bowel, as best we can, no test is perfect, then we see an overrepresentation of pro-inflammatory bacteria and an underrepresentation of the anti-inflammatory bacteria. And then we just want to kind of modulate the gut and flip that kind of presentation. Oftentimes we'll see overgrowth of bacteria in the Proteobacteria phylum. So you can see the Enterobacteriaceae family, things like E. coli and Citrobacter and Klebsiella and Proteus. You can see overgrowth of those pro-inflammatory bacteria. And then also another kind of family within that same phylum that I don't hear being talked about too much, it's not really on most clinicians' radar, is the microbes, the bacteria that produce hydrogen sulfide. So two really popular overgrowths, common overgrowths that we might see in inflammatory bowel disease would be Bilophila and also Disulfovibrio. And they produce this toxic gas, it's called hydrogen sulfide, and it's been shown to actually pull apart the mucous membrane bonds and expose the cells that line the gut in the large intestine to the microbiota. And that just really triggers this inflammatory response, and it just ramps up the immune system. It turns it up into overdrive. There's no one size fits all here. Each individual IBD patient's microbiota needs to be assessed, and then we need to treat based on, what the results were from that test. So reducing the pro-inflammatory bacteria, increasing the anti-inflammatory bacteria, and trying to balance and modulate that inflammatory response. And the approach there is minimizing those triggers that push a patient into a flare of inflammatory bowel disease, into the active form of IBD. Different tools to modulate the gut microbiome would be prebiotics and also probiotics. And then we can use very targeted herbal medicines, either antimicrobials or tonics, to treat the results of that test, and oftentimes the results of these microbiome assessment tests line up with the symptoms that the patient is experiencing. Thank you so much for watching. I hope you got something out of this. If you have any questions or comments, you have any experience treating your inflammatory bowel disease, then leave them in the comment section below. I love the interaction and I love the discourse. And if you are struggling with inflammatory bowel disease and you're looking for some natural treatment approaches, then get in touch with us here at Byron Herbalist and we'll see if we can help you out.